The pain regimen really starts during the surgery. So I will give you a lot of numbing medication to the nerves that go to the penis. That typically gets you through the first night and day after surgery. The anesthesiologist will also help by giving you some pain medications during the surgery to make sure that that lasts after, and we make sure that your pain is under control before you go home, with a combination of anti-inflammatory medications and some opioid medications. I send you home with a handful of opioid medications as well to help with any breakthrough pain, but the mainstay of pain treatment afterwards is icing, ibuprofen, or any anti-inflammatory like Aleve, Advil, and Tylenol. Those are usually good enough to get you through the surgery. While you have some swelling, the pain is really not all that bad, and so we can usually manage it with over-the-counter medications and some opioid medications for breakthrough pain as needed. After surgery, you'll have a wrap around your penis and scrotum that's meant to be there as a compression dressing. That comes off somewhere between 2 and 3 days after surgery. You can still pee normally, you can still walk around normally, but that really helps decrease some of the swelling. At the same time, you can put ice over the top of that bandage, which also helps decrease swelling. After the bandage comes off, ibuprofen and ice are really the mainstay of decreasing that swelling. And so putting that on every 20 minutes for every hour and taking ibuprofen around the clock for the first week can really help reduce the swelling and bruising. I close the incision site with dissolvable sutures and then put some skin glue over the top of that incision to help keep it closed. That skin glue is really like Gorilla Glue that you would have at home, and so it stays on there a decent amount of time, usually somewhere between 2 weeks. So the incision is not really a whole lot of work. You can shower normally and let water run over it. Just don't want you scrubbing it or doing anything that would peel that glue off. But that really creates a nice barrier to infection and wet that stays on for a long period of time, so the incision is pretty low maintenance. We do secure the pump into your scrotum with some sutures to keep it down in the dependent area where you would find it after surgery. But after that compression dressing comes off 2 or 3 days after, I really want you pulling on that pump down into the scrotum twice a day, usually when you're voiding or peeing in the morning and at night. So I want that to start pretty soon after, and oftentimes it can be a little bit sore and a little bit swollen, but we will show you where to find that pump and how to pull it down every day after surgery. Both anesthesia and the pain medication can create some level of constipation. You won't be taking the pain medications for all that long after surgery, but we can give you some over-the-counter recommendations for stool softeners, and we can give some prescription stool softeners as well. In general though, hydration, walking around, doing your normal daily activities to keep things moving is really the best thing to help, but we can always augment that with some medications if need be. After the surgery, I don't want you lifting anything more than 15 pounds for somewhere between 7 and 10 days, depending on how well you recover. That's really to prevent any excess bruising or swelling as you put pressure on your abdomen with lifting and puts pressure on your scrotum. The bathing part of it is a little bit longer. I want you to wait about 2 to 3 weeks to bathe, sometimes longer if it takes longer for those stitches to dissolve. I really don't want submerging in pools or going in lakes or the sea, just because that creates a lot of bacteria that gets introduced to your device, and as we talked about, bacteria and the device don't really match up. So I really would want that to be held off for probably closer to 4 to 6 weeks with swimming. But you can shower normally, you can start lifting shortly after that week. You should be back to normal for the most part within 1 to 2 weeks, with the exception of swimming. As long as you're not taking the opioid medications, you can drive whenever you're ready the day after surgery. So the first day after surgery, you've just had anesthesia, we don't want you driving. But the next day, if you're not taking opioid medication, you should be fine to drive. Going back to work really depends on what you do for work. If it's a desk job or you're working from home, you can kind of tailor that to you of going back as soon as you're ready. I recommend taking a day off of work You're just going to be sore. You're not going to want to do a whole lot. Be a little bit groggy from the anesthesia. So the next day, certainly I would recommend. For most patients, it's probably somewhere between 3 to 5 days of off work, no matter what they're doing. If you have lifting with your job, we would want you to hold off from lifting or going back to work with lifting 7 to 10 days after surgery. If you can do light duty, you may be able to go back earlier. This surgery does create a decent amount of swelling in the scrotum. Just by the nature of how I do the procedure, there is a lot of vasculature and blood supply to the scrotum, and so you do end up getting a decent amount of swelling. That swelling doesn't always accompany any pain that comes with this. The pain is usually the first few days. The swelling can really last that first 2 to 3 weeks, and so that's really what I would expect afterwards. Some guys do better, some guys do a little worse, but on average, when guys come back to see me for their teaching, their scrotum and their implant is back to normal and they feel pretty well. If there was any leakage from the incision site or drainage, anything that looks like it shouldn't be coming out of that incision, I would want to know about. I am much more conservative with these in that I really want you to tell me about anything that looks abnormal. The nice part about the way that I close the incision is that glue really does keep everything closed and watertight, and so there's not usually a whole lot of complications. But if there was a lot of redness, swelling, warmth, pain around that incision that persists past that first week, and certainly any drainage out of that incision, that's something that I would want to hear about. The only appointment that you really need is the 3 or 4 week after our surgery. That's where I teach you how to use the pump and pump the device up. There are some guys who have persistent pain and may not be able to tolerate pumping up the device at the 3 to 4 week period, in which case I will happily see you back 2 or 3 weeks after that to get you shown how to use the device and get you on your way. But most guys only have to see me one time after surgery, and then they are good to go use the device and see me as they need to after that. I would teach you how to pump the device up and cycle it between 3 and 4 weeks after surgery. As long as you show me that you're able to do that without too much discomfort and without any problem, you are able to use it 1 week after that. So on average, guys are using it between 4 and 5 weeks after surgery. Our nurses and myself are always available. You can send a MyChart message or call us. If there are questions related to the device and how to use it, I am available to help you with that. We also have a Coloplast rep who is on your case that you can contact to help you with any issues with pumping up or using the device as well.